A 17-year-old male presents to his general practitioner with a 1-week history of fever and fatigue. He is normally well with no past medical history. His observations show respiratory rate of 16, heart rate of 85, blood pressure 120/84, temperature of 37.1, oxygen sats 97%. On examination, you note conjunctival pallor and firm masses in the right and left upper quadrants of his abdomen. What is the most appropriate initial management of this patient? Let's see what's going on. 17-year-old, 1-week history of fever and fatigue. Normally well. Observations. There's a normal breath rate. Heart rate is slightly high but normal range. Blood pressure, normal. Temperature, normal. Oxygen saturation is normal. You note conjunctival pallor, firm masses in right and left upper quadrants of the abdomen. Is it hepatosplenomegaly? In this case, it's pallor, anemia. What's causing his fever and fatigue? Could be an infective cause. 1 week sounds like an infection with fever, fatigue. Could be caused by anemia, could be caused by the infection. Let's see, what's the most appropriate initial management of this patient? What do we think this is? Arrange an urgent abdominal ultrasound. Is this to assess the size of the liver and the spleen? Let's look at other options. Immediate referral for specialist assessment. Hepatosplenomegaly does seem quite suspicious and something that should be managed by someone who knows what they're doing. Immediate transfer to emergency department. So yeah, at outpatient, is it? Yeah, GP. Immediate transfer to emergency department. Is it that serious yet? Routine referral for specialist assessment. Send home with safety netting advice. Let's see. He looks quite stable. But you didn't do an FBC here. You didn't do a full blood count to check his hemoglobins, platelets, and white cells. This kid may be having a lymphoma with hepatosplenomegaly here. Could be having a leukemia. I think transfer to specialist if you already know this is a leukemia, or emergency department. They can do the FBC for you, but he's not currently acutely very unwell, so immediate referral for specialist assessment. Should be within 2 weeks cancer pathway. Routine referral might be too slow. You need to act fast on this if you're suspecting leukemia. Yes. So children and young people 0 to 24 years refer for immediate specialist assessment for leukemia if unexplained petichiae or hepatosplenomegaly. Does he have petichiae? I did not read that. General practitioner, 1 week history, fever, fatigue. No mention of petichiae at all. Okay, never mind, he had hepatosplenomegaly. The correct answer is immediate referral for specialist assessment. This patient's presentation of conjunctival pallor suggesting anemia and unexplained hepatosplenomegaly mean a diagnosis of acute leukemia cannot be ruled out. Any patient under the age of 24 presenting with unexplained petichiae or hepatosplenomegaly requires an immediate referral for specialist assessment for leukemia. Petichiae occur due to thrombocytopenia secondary to splenomegaly. Arrange an urgent abdominal ultrasound is incorrect. While ultrasound may be performed, the priority is making the referral to secondary care specialists who may then request an ultrasound. Immediate transfer to emergency department is incorrect. While this patient requires an immediate referral, he does not need to attend the emergency department. Routine referral for specialist assessment is inappropriate, as this patient should be referred immediately. Send home with safety netting advice is incorrect, as leukemia needs to be excluded. Management of suspected hematological malignancy in young people. Any of the following features in a person aged 0 to 24 years should prompt a very urgent full blood count within 48 hours to investigate for leukemia. Pallor, persistent fatigue, unexplained fever, unexplained persistent infections, generalized lymphadenopathy, persistent or unexplained bone pain, unexplained bruising, unexplained bleeding. Okay,